you very much, Dr Murison. It's a pleasure to serve under your chairmanship. And I would like to congratulate my good and honourable friend, the member for Strangford, for securing this really important debate. I find myself, not on the first occasion, agreeing with much of what the honourable member said in his opening remarks. Clearly, drug deaths are at a record high, mainly from opioids, but deaths from cocaine have risen by almost a third. And as my honourable friend said, the synthetic opioids, such as the fentanyls and the nitazines, present an increasing and alarming threat that I don't think has been properly quantified. We've seen the growth in deaths across the Atlantic, and I suspect it's a much bigger problem here than we know about. There's no doubt about it, it's a public health crisis, and sadly, the northeast of England has had the highest rate of drug deaths in England, 3 times higher than in London. In the latest stats released in October of last year, the northeast recorded 174 deaths per million, compared to an England average of 90. Too often in the communities I represent, I've seen people turn to drugs because of deprivation and despair. And once addiction takes hold, it often leads to crime. It's no coincidence, Dr Murison, that drug deaths are highest in the areas of greatest deprivation. The data is clear. Communities struggling with poverty and inequality are also those communities hit hardest by addiction. It's not a new problem. Certainly it's a complex problem, but it's been exacerbated by disinvestment in harm reduction and drug treatment programmes. And if we are serious about tackling this problem, we really need to do something different. To some, a tougher crackdown may seem like the obvious response, but we've had over 50 years of evidence showing that punitive drug policies do not work. The war on drugs has failed, not just in the UK, but globally. And we simply cannot arrest our way out of this crisis. That is why today I want to offer a different perspective, one that moves beyond outdated, one-size-fits-all approaches. Abstinence-based recovery is certainly one path, but it's not the only one. If we truly want to reduce drug deaths and support recovery, we must reduce harm, reduce stigma, invest in treatment provision, with protected, ring-fenced and sustained long-term funding. This funding could support solutions like opioid substitution treatment, which saves an estimated 1,000 lives annually, medically supervised overdose prevention centres, such as the Thistle Safer Consumption Facility in Glasgow, heroin-assisted treatment and the increasing availability of drug testing. These measures are crucial in addressing the current crisis and saving lives. As chair of the Drugs, Alcohol and Justice APVG, which is supported by treatment providers VIA, Way Through and With You, I recently had the honour of chairing a meeting where Professor Sir Michael Marmot, the leading expert in health inequalities, laid out the stark reality, and he told us social injustice is killing on a grand scale. He made it clear that areas of the greatest deprivation suffer the deepest cuts during austerity, exacerbating addiction and its consequences. I would encourage the Minister, indeed all government ministers, to consider how we as a nation can adopt the Marmot principles that foster a fairer, more equitable society. A society where everyone is given the best possible start in life and where we work to prevent deaths of despair. If I may, Dr Murison, I'm very conscious of the time, but I just want to mention a dear friend of mine who's no longer with us, the late Ron Hogg, who was the Police and Crime Commissioner in Durham. He was a true pioneer of drug policy reform. He was bold, compassionate and unafraid to challenge the status quo. He introduced heroin-assisted treatment and diversion schemes at a time when they were far from popular. But popularity wasn't his goal. He was seeking to reduce harm, save lives and even ease the burden on our criminal justice system. The evidence is clear. Investment in treatment works, harm reduction saves lives, tackling stigma is essential. We must stop seeing addiction solely as a criminal justice issue and instead treat it as an urgent public health emergency.